Today's event here in Santa Barbara really is reflecting a national concern about what is happening with healthcare, what is going to happen with healthcare. Actually, I was lucky enough yesterday for the first time to be invited to the White House to attend a speech that President Obama gave, and then spend some time in the afternoon talking to Medicare officials. A bunch of us throughout the country were invited because this is truly a national issue. And I think that the point that the President made yesterday is a good one, that there has been a lot of success in expanding access. The number of uninsured has dropped by about 30% in a little more than a year, which is pretty phenomenal, but there's a long way to go, and there's a lot of work that still needs to be done. And this was an opportunity nationally to convene people, and really now the same thing's happening locally. An opportunity for people who are in the profession here to really talk to the community and try to understand what their concerns are and give our perspective.
Well, Visiting Nurse and Hospice Care is hosting the second annual Forum Perspectives in Healthcare event. And this is where we bring some of the major healthcare providers in Santa Barbara together to talk with the community and have a conversation about what's happening in healthcare. This is a very transformational time across the nation in healthcare with the Accountable Care Act, and so we're really going to have a conversation about how is that impacting us in our community in Santa Barbara.
SunCal Health administers Medi-Cal in both Santa Barbara and San Luis Obispo counties, and what we've had to adjust for is a significant growth in the Medi-Cal population as a result of the Affordable Care Act. We as an organization have grown about 35 to 40% in the last 12 months. And in Santa Barbara County alone, we now insure about 110,000 people on the Medi-Cal program. And I think that's important because not only the sheer numbers of people, but Medi-Cal is evolving as a program. Historically, it's been thought of as the program for the destitute who have no other means to achieve health care. Medi-Cal's evolving now, where it covers a lot of people who may work and they may have jobs, but they just either can't afford health insurance or their employers don't offer it. And the eligibility criteria has changed, so it depends on how much money you make and how many children you may have. So Medi-Cal's evolving. It now covers a lot more of the population than it used to. In fact, the state of California projects that 1 in 3 Californians will soon be covered by Medi-Cal. And today, according to the state, 50% of all children get their health care through Medi-Cal. So you can see the program's evolving, and we have been evolving with that change.
Really, the concern nationally is about achieving greater efficiency. There's a lot of areas in the country where the amount of hospitalizations are much greater than other areas, and the expenses are much greater for Medicare. Santa Barbara actually does really well on those metrics. We have really good utilization. We have great physicians in the community. We have great organizations like the ones represented today that are involved in healthcare. And so we have a head start on a lot of areas.
I think our vision is that this will be much like the economic forum that we have in Santa Barbara. We plan to continue this every year annually, and to really have an opportunity to talk about what's going on in Santa Barbara, how are national events impacting us here in our community. This is an opportunity to have an exchange between our community and our distinguished panel.